So a bunion is a malalignment of the big toe joint. The bunion starts by the big toe moving towards the outside of the foot, which then causes the metatarsal, the long bone of the forefoot, to move towards the other foot. People who develop bunions often have a family member that has had a bunion, and they have inherited a gene that can lead to bunion formation. Now, the expression of this gene does not always occur, and therefore it can skip generations. Bunions can be treated without surgery, and this includes accommodative footwear, painkillers, and as well as activity modification and avoiding activities that make the joint painful. Also, padding around the joint can be used to reduce the pressure onto the prominent joint. It's important to know that bunion splints, unfortunately, do not slow the formation of a bunion. So over time, the bunion will worsen, but how quickly it worsens is variable. And often an increase in size doesn't always mean that you're going to have a correlation with an increase in symptoms. However, over time, secondary problems can arise as the bunion moves. As the bunion size increases, it can throw weight onto the second toe joint at the ball of the foot, and this can lead to pain and discomfort, and often disruption and damage to the soft tissue structures around the second toe joint, which can lead to hammer toe formation and also subluxation and dislocation of the second toe joint. So bunion surgery aims to realign the big toe joint by repositioning the first metatarsal through cutting and realigning, as well as often the big toe. Following on from the realignment, screws, plates or wires are used to hold the bones in the corrected position whilst they heal. Following the procedure, there will be a period of downtime, and post-operatively either a surgical shoe or an air cast walker boot is used to protect the foot in the initial stages. So pain is subjective, but with modern anesthetic techniques and analgesia, pain can be managed. The foot is most painful during the first 24 to 48 hours, with the skin healing taking around 2 weeks and the bone healing around 6 weeks. For a return to more high impact activity, you would be looking at around 10 weeks. So following foot surgery, following the bunion surgery, you can mobilize, and this would either be in a surgical shoe or a walker boot, and this is dependent on the procedure. You will be limited for a period of time, and this is to allow for the bones to heal. So there are always risks associated with surgery, and these can be categorized into general risks, that are problems that can occur following any operation, and specific risks which are related to the procedure. Therefore, before making a decision about surgery, the benefits and risks are discussed and information is provided for reflection. Thankfully, due to modern surgical techniques and fixation, the metalwork that's used to hold the bones together, the risks of bunion surgery are much reduced.